Hello, everyone, and welcome to Mind Your Mental. Just a reminder that this podcast is not meant to be a substitute for a relationship with a licensed mental health professional. I know they are hard to find, and I get that. I have a bunch of resources on my website if you need them, but I am not your clinician. I am a psychologist, but I am not your psychologist. So if you need any specific help, please look for the help of a licensed mental health professional. Learn all you can learn from the podcast. Enjoy the episode. All right, everyone. Welcome to Mind Your Mental podcast. Today, we have one of my faves out here in these psychological streets. We have Dr. Thema Bryant. She's the 2023 president of the American Psychological Association, which is the leading scientific and professional organization representing psychology with more than 120,000 members. And I will say that when I went to the APA conference, the one I went to was when you were presiding, and I've been to ones previously, and I was like, yo, this one has way more Lowry's on it. There was just so much more seasoning on it. I just enjoyed myself. And I saw some newer students and they were like, oh, this is our first year. And I said, I'm sorry, this is your first year because your expectations, this is higher than I'm be real with you. This is actually way cooler than it typically is. So I literally said this is a tough one to make your first one, y'all. It's like, I've seen the bar. So I think you raised the bar a little bit too much on that. Some people may, but Dr. Bryant, thank you. I had a good old time. Me and Earl was sitting there dancing. Listen, Dr. Erlanger Turner, my bad. Yeah. But Dr. Bryant has so many different aspects of expertise. In addition to being a psychologist, she has also earned her Master's of Divinity and is an ordained elder in the African Methodist Episcopal Church. I grew up in an Episcopal AME church. I'm from Philly. Okay. And my mom is Baptist, but my godmom, her church is an AME church. I grew up hearing about Richard Allen.
Mm-hmm. Yes. All right.
Yeah. So when I go to churches, I'm like, it's hard because I grew up in real more older school, and even my church was embedded in Hey everyone, just a reminder that Mind Your Mental is not just a podcast. It is also a amazing community, if I do say so myself. It's phenomenal. I mean, you get more access to me. What more could you want in this life? So if you want to join the community, if you're not already on the community, go to my social media. My social media is the same, Raquel Martin, PhD, and DM me the word community so you can get details on joining this amazing flipping community. You get more access to me, y'all. I'm a delight. All right. Hope to see you there. Individuals of African descent. Yes. So it was, when I moved, I was like, this don't feel like how it felt when I was younger. I'm used to good choirs. Yeah. I'm also used to everyone being significantly older than me. So I actually felt odd when there was a lot of people my age at a church, because in the AME church, I'm just used to
seniors,
older people. So seniors, yes, hymnals,
right?
So I was like, one time I was looking for a church, and I was I couldn't see a choir, but I saw a guitar, and I was like, what's this?
What do we do?
I need to see some robes and an organ. What are we doing? What? I need at least 4 choirs, women's, men's, youth. You got to. Yes. You know what I'm saying? I said, what?
Yes.
I said, oh, my acoustic guitar. What's this? I was like, this
is different. This is different.
But listen, when it comes to certain things, I like what I like. You know what I'm saying? I need, after church, I need to be smelling chicken. I do need church punch.
Got to.
With the
your
ginger
punch
ale
and your pound cake.
Yes. I need, I need all of that. I need to ask the lady next to me for a mint. She needs to have candy in her purse that I've literally never seen sold in stores.
Yes.
Mm-hmm. See little girls with those white socks and itchy stockings, all of that.
Oh, yeah.
That's my
adorable. Yeah. But now we have arrived.
One of the reasons why I wanted to have you on the show, because you have so many realms of expertise, and I was introduced to you. I was saying earlier, I wish it was earlier, but when I was out of my training, it was towards the tail end, and I was looking more about, I think I looked up mental health and social justice, and liberation psychology comes up. And honestly, you always come up in that aspect of it. So I thought today's episode would be fantastic, not only for current clinicians and clinicians in training, but also people who are looking for a therapist or a licensed mental health professional or something where they feel like they can relate, because I very much saw myself in liberation psychology. Like I felt like the only reason why I feel like I decided to be a psychologist was because I went to Fisk. I always say that if my first psych class wasn't at a HBCU, I don't think I would have wanted to be a psychologist. Like it was one of the few classes, psychology and Black history were one of the few classes that didn't bore me to tears because I saw myself in the curriculum. Like my professor was talking about Jawanza Kunjufu and, was talking about Kenneth and Mamie Phipps Clark and all of that. And I had never known that people that looked like us or people focusing on historically excluded populations could also do that through science and like mental health and therapy. So I very much saw myself in that. So I was like, who would be great to talk about this? The person who I've always admired from afar and now up close when it comes to liberation psychology. So how would you describe liberation psychology to someone who has never heard of the concept and you're like, hey, I'm gonna put you on game. It sounds like this is something for you.
Yes, absolutely. So the first thing I would say is liberation psychology comes out of liberation theology. And so it's great that we started off talking about the church because at its roots, it's holistic. Whatever someone's religious or spiritual convictions are, that we don't leave the soul work out of the therapy process. And psychology means study of the soul. So it is not limited to cognitions. It is not just about our feelings. It is not just about our behaviors. It is about you as a living soul. What is the aspect of you or the part of your client that remains even after the stress and trauma and drama of life? And like speaking to that aspect of the person. Liberation psychology is a commitment to attend to context. That context matters. It is not just about positive thinking. It is not just that you have distorted thoughts and we don't know where those thoughts came from, but that we grow up in systems, in interlocking systems of oppression that teach us to reject ourselves, to hide ourselves, to doubt ourselves, and that create and maintain a hierarchy of power. And marginalized people are at the lower end. And it's not because they're just at risk or that they have deficits or that they need to be rescued. It is as a result of these systems. And so one of the critiques that comes from liberation psychologists to many other models is the tendency to ignore context, including oppression. But another part of liberation psychology is a commitment to not only eradicating or pushing back on oppression and healing the wounds they have within us, which includes internalized oppression when we come to believe the lies we've been told about ourselves. But liberation is also about reimagining what is possible. So in other ways, we might hear about that as post-traumatic growth. We might hear about that as positive psychology. But at its core, that our work is not just about symptom cessation. So if I'm just trying to decrease your symptoms of depression and anxiety, I still have not spoken to joy, to purpose, to love, to the fullness, the abundance of life. So it invites the therapist and the mental health professional to imagine what can this individual, family, community look like free? What would it look like for you to live with freedom?
And I really appreciate that because I feel like when I was in my training, that was something that I felt was missing. Like I knew I wanted to get into psychology and mental health to help the Black community. I was very open and got very much a lot of pushback about saying that like you talk about specialties and people can discuss like personality disorders and anxiety. People talk about focusing on children and adolescents and families. And through my whole entire program, anytime anyone asked me, I said, I want to focus on Black people. That's what I want to focus on.
Yes.
And I got asked things like, well, don't you think that's pretty limiting? I don't think that's an option. And I'm like, I'm always just like, well, we always say that our mental health is linked to the way the world treats us. Do Black people not get treated differently than anyone else? Can we not identify that there's a difference between anxiety as a result of attachment issues versus anxiety as a result of racism related stress? Don't you think we could benefit from people who understand the intricacies of the whole experience? And I got so much pushback. And I was always just like, Y'all looking at me like I lost my mind. I'm looking at y'all the
Right.
same way because I feel like I'm making perfect
Yeah.
sense. Like,
And what it is, and I'm so glad you're giving this example, is people are so used to minoritized people remaining in the margins. So we are an
yeah.
afterthought, right? Even in therapy, this is the model. And then if you want to modify it for this group, I remember when I was in training, we were learning this CBT group for boys who, kept getting into conflict and trouble in school. And
Mhm.
their idea of modifying this intervention for Black kids was the affirmation statements, the statements you're supposed to say to yourself to avoid getting in trouble. They made them all rhyme. So then they would have to say, like, I won't be a fool. I won't lose my cool. Right? Now,
Yeah.
now it's culturally congruent. I'm like, what in the world? Yes. Or our Native American siblings have said, they use the same intervention and say, hold a feather. And now it's for us. Right. So instead, as you're naming, what it means to center us, that in the very creation of the model, we are who you have in mind. And that's going to be a
Yes.
very different feeling.
I think so too. When I was doing, I'll never forget my dissertation defense, one of my committee meetings, and mine was on minority mental health disparities within children of individuals in the military, diagnostic disparities. And when we were reviewing the data, one of my committee members mentioned, it wasn't even, how sometimes people will raise their hand like it's a question, but it's really like, oh, I have a statement. I don't
Yes.
need that right now.
Right.
I just need to know how much longer do I
Yeah.
have before I can graduate, y'all? I need y'all to answer me that. Like, that's all
Yes.
I'm asking.
Yes.
And she said, I noticed that you didn't go in as much detail in the data when it came to, she said white, but I said European American data. She said, she said, I think you could have gotten more salient information. Like, what was the reason for that? And I said, they were not my population of interest.
Yes.
And I think,
It was
sometimes there's like,
insulting.
I think, and sometimes I
Yeah.
think they're like expecting you to fill the air. And I was just
Right.
like,
It's just sit with it.
do we have more questions? Like,
Right.
like this,
Right.
it's okay for me to
Yes.
say like that's, and I feel like when it comes to modalities and therapy, and just like you mentioned, I think people will state that like, oh, it's altered or whatever, adjusted for certain cultures because we made the characters have afros on them. With not even thinking of like, well, no, there's a difference in the way that things are processed because once again, it's inextricably linked to the way the world has treated us. And, I get asked questions about when's old enough to discuss about racism or stuff like that. And I'm like, well, my son literally experienced racism in utero. So I'm going to be honest with you. Think about as early as someone can experience it. That's probably as early as you can discuss it. And we can't act like we're grown up in a bubble. Like it's our mental health, it's our well-being, just like you mentioned, is the study of the soul. And I think there aren't enough people, well, there weren't. There's so many amazing models now where they're just like, it's not meant to be a comparison, right? Like my goal is not to look at Black people in comparison to anyone. My goal is to look solely within the diversity of the Black experience. And I think there's so many individuals who feel as though, and I think that's one of the biggest stressors with Black people is like having this expectation to be in this one box where there should be more agency and there should be more talk about the diversity within the Black experience. Like saying that I focus on individuals of African descent, I said, and honestly, I'm like, that's not even enough of a specialty because when I tell you, like that's
the range.
that's a lot. That's a huge range.
Yes. And the piece of the intersectionality and often this belief that race overshadows or erases or makes, everything else identical. But attention to gender and sexuality and disability and migration status, like all of those things affect how the world sees us and treats us. Even the term gendered racism. How do people treat Black men versus Black women? What are the assumptions when they see us? And so I think people often want a quick fix, especially in like training programs, right? And so the phrase is like, well, depression's depression. Well, actually, it's not. Right? Depression shows up very differently depending on your culture and your context. And so I think people take it as a hardship or like that it's overwhelming that there are so many different groups and peoples, but it's actually like a gift to be able to bear witness, to learn about, different people's community, and then that the lens they have of like, what does this mean to them? Even the fact that they showed up in my office, what does it mean given their religion, given their race, given their age, and how that affects the healing process.
Yeah, I think there's power in the aspect of specialty because there are places that affirm me as a Black person and maybe not as a Black woman, as a Black woman and maybe not as a Black mother,
Yes.
as a Black mother and maybe not someone who has, as someone who is educated. I have a significant aspect of privilege. Like I know
Yes.
where I'm going to sleep every single night. I have health insurance cards.
Right.
As long as I'm not, going out to buy a couch, I can swipe my card and be okay. These days, grocery store visits are even getting concerning. Like my children
yes,
eat way too much fresh fruit is
Mhm.
concerning.
Mhm.
But I just understanding that like there's so much power in that intersection of identity. And even when
Right.
you mentioned like the gendered aspect of it, I try to focus more in my work and research on Black identity development. And I remember someone asking like, oh, well, can we do a model where it's just like we're looking at boys and girls in the same place? And I said, actually, it's actually more helpful to look at the gendered aspect because there are certain messages that young boys get that young girls do not get.
Right.
When we talk about the reasons why depression and everything like that manifests differently, people don't always know that there are differences in cultural display rules. Like if you have an entire group of individuals who have never been told or shown that it's okay to express themselves, that have been overtly or covertly told that their feelings do not matter, they're not allowed to have them, if they can't even acknowledge emotions, let alone the range of emotions, there's a difference between being sad and depressed and hungry and famished and happy and ecstatic. And if you have a people who are so used to blunting how they feel, masking that, and they can't even address it to themselves, imagine how hard it is to be across from someone in session and appropriately assess them if you don't know that. Like if you think, oh, they seem angry, that must be anger. If you don't know stuff like, oh, well, let's think about the anger iceberg, right? The Titanic sank because what was below the water, did it not? Yes, right? So like you're seeing anger. Okay, that's the easy one to see. Are we also seeing shame and guilt and sadness? Like I was talking to my students about this recently and they were asking me, students always have like the most, they have like the simplest questions that I'm like, I too am trying to answer this. But they were like, what's the big what's the issue? Like why can't they just why are we getting diagnosed wrong? And I was like, okay, well, let me do something I know y'all hate. Let me answer your question with a question. And they're like, oh my God, just answer the question, doctor. And I'm like, do you think you can assess someone that you don't see? Right? Like, do you think you can assess people you don't see? And they're like, no. I'm like, okay. So that gets to the colorblind perspective, right? Do you think you can appropriately assess someone that you're afraid of? And they're like, well, no. I'm like, well, a lot of people genuinely just fear Black skin. Do you think that you can assess someone that you haven't taken the time to learn about their individual experience? Like, do you think you can appropriately assess men if you've only ever worked with women? And they're like, no. I'm like, would it surprise you to know I'm at a HBCU? I was like, there are people who don't have a significant amount of experience outside of media, which has stereotypes, outside of books, if they see them, with Black people. I was like, y'all, I know we're in Nashville and we're at a HBCU, but I'm gonna be honest with you guys, not everyone is gonna see Black people, let alone in person, let alone have conversations with them, and they can still become licensed and work with this population. How hard would it be to do an appropriate assessment of a man if you never worked with a man in your life? And you're like, I've only had women participants, but this is, I'm sure it's similar. I'm sure that's fine. I'm sure this is cool. This is cool. Just show me where the ovaries are. And they'll be like, what? Because that's literally how, because in my opinion, that's how bad it is. Like, man, this person seems so hyper vigilant. Like, oh my God, I don't know what the heck their problem is. Yeah, they're Black.
Vigilance for survival. Yes.
Yeah, vigilance for survival, because I've said oftentimes it's a privilege to not have to read the room, in my opinion.
Yeah.
I don't know many Black people who don't scan the room to see safety.
Yeah.
I was talking to one of the trainees and she was like, it's hard to understand. And I was like, okay, so you're a woman. Do you not scan the room if you're in a room full of men? She was like, yeah. I was like, the hypervigilance that a lot of women feel when they're the only woman. I was like, think about that. But think about that with the world. Like, imagine if you were only in rooms where you're like one of the few women there. Imagine if you were only in rooms, whether you're going to work, school, home, how would you feel? And she's like, oh, I'd be stressed out. Yeah. And it's awful. That's like, the thought
Yeah.
process, because a lot of women can relate to that. A lot of women can relate to holding their keys in their hand. A lot of
Mhm.
women can relate to, oh, I'm not parking on the bottom floor. I'm not going to be able to go to this place because I can't do that. A lot of women can relate to, it's dark. I'm gonna have to spend the night at your house, girl, because I can't walk home. That's what a lot of Black people feel like, hypervigilance. I get uncomfortable around police all the time, and I'm a stand-up citizen. Like, I may be a little radical,
Mhm.
but I'm a stand-up citizen. And
Yeah.
every time I'm like, I
So
get uncomfortable.
imagine feeling that all of the time and then going to therapy for months, even years, and never being invited to talk about it. It's like you don't
Yeah.
even know this client. You don't even know them. Whatever you all have been working on has been a fraction, a glimpse of who this person is. So a part of liberation also is to see people wholly and completely, and also to know, along with cultural oppression, there's also just the gift of culture. Along with race, there's not just racism, but it is like the gift. Is when people say we not only have ancestral wounds, but ancestral wisdom. So liberation doesn't mean that now every session has to be about the trauma and terrors historically and in the present. That in the liberation, there's also, what is the wisdom that either directly or indirectly you got from your community about how to navigate these spaces. Even if you're the first one on a college campus, they showed you some things about how to preserve yourself, protect yourself, nourish yourself. And if, had interracial adoption or your parents just never talked about it, that it's not too late to learn. So some people learn these strategies growing up with like racial and gender socialization. And some people's families thought that the silence was to protect them, right? That if I don't talk about it, right, then they will just feel confident and then they can just go conquer the world. And so that being unprepared often then leads to more of the blame and shame of like, I must be doing something wrong. Because if it's a meritocracy, you get rewarded by how hard you work, and I keep hitting that glass ceiling, then like, what's wrong with me? Versus this system is operating in the way it was designed, and it was designed to keep you out, and you are still worthy.
That's one of the reasons why I try to focus on, you hear so much about breaking generational curses, and I'm always like, or how about we talk about building generational bonds? I don't know. I that language a little bit
Like
better.
it.
Can
I
we
like it.
like focus on that language?
Yes.
How would that look in session? Like, how would you, like, say someone's looking for a clinician, and they're not, how you state clinical psychologist or clinical social worker, and they're not outright stating that, like, oh, I also identify as liberation psychologist.
Mm-hmm.
How would that look in session? Like, what are some signs to be like, okay, I think this person is actually
Yes.
leading in the
Mm-hmm.
aspect of liberation? Like, what would that look like in session?
Right. So, a question that you can commonly ask is, along with whatever this presenting problem is, my relationship problems, my financial stress, panic attacks, a big part of my identity is my race, is my gender, is my sexuality. What is your experience with working with people with my same identity? And what are your thoughts about how discrimination could be affecting my mental health? Like, that's an easy question. So if they're stumbling, if they say, I see people as people, I'm out. I'm out. Because then I just told you, like, this is a part of my identity. If they tell you they used to date a Black person, I'm out. That's not what I asked you. So they should have a comfort with being able, and it shouldn't be like a surprise or startling that you're wondering their ability and also their mindset, right? If anything, I'm so glad you asked that question. I think it's fundamental. And here are the ways that I approach it or look at it. And then if you don't feel comfortable like initiating that exchange, and do know when you go to therapy, they're seeing if they're a match for you, but you also are seeing if this person is a match. But, so we have in the beginning, it's usually what's called an intake session. So we ask you questions about all the things psychologists have decided are important, because we want to get an idea of you. Once we have an idea of you, then we're going to come up with the treatment goals together of what are we working on. So they're going to ask you about your work history. They're going to ask you about your relationship history. They'll ask you about your health, about substance use. If they ask you a bunch of questions and don't ask you anything about your various identities, or about bullying or stereotype or oppression, they're not tuned in. They're not.
Mm-hmm.
So that would be a warning. And now they might be following the clinic form, and maybe they have other consciousness and it's not reflected in the form. And then I could just say, a lot of times they'll ask about trauma history. So, you asked about the stress and trauma in my life. Is this a good time for me to tell you about how racism has affected me? And even with that, you're having to work too hard, in my opinion, because they should be creating the environment. But if you want to give it a try, because I have had people who say, I like them for everything else, but I think I'm going to have to go to somebody else to address the racism, right? And so, if it feels like a good connection, this is someone I feel like I can relate to in general, where they gave me some helpful things about my eating disorder or panic, then you can offer, I was hoping we could address this, and see what they do with that.
Yes. See, this is why I love Dr. Thema. So once again, I always say, like, I loved you before I met you, but because I have a finding a therapist guide, and I have like the typical questions like, okay, let's get to this money. How much we charge? And you do a sliding scale. But I also have a section. It's like, hey, so some important aspects of my identity are this and this. Yeah. Do you understand that? Do you grasp these topics? Have you worked with anyone with these intersecting identities? And I always tell people it's important to see what they say, also what they don't say, because you can tell when people are uncomfortable discussing racism, or, I'm okay with people not understanding everything. I get to decide if that's okay. But like, I don't like when you can tell somebody doesn't know what they're talking about, but they don't feel comfortable acknowledging that. That's odd to me, because it's like, well, here's the thing. I'm not going to know everything and you're not going to know everything. But if you don't feel comfortable as the clinician in the room, admitting that you don't know something, because that's not being genuine to me.
It's not. And it makes our radar go off of like the vigilance of, as you said, I'm scanning to see, is this safe? And let me say, authenticity is safe, right? If someone authentically doesn't know, and they know they don't know, then okay, I can decide what I want to do with that, right? But the pretending or the like pulling in stuff that does not matter here, because it's the only way you can think you can relate to me. Now that's creating ruptures and problems.
It's one of the reasons why I say I think people of the global majority tend to have the best BS meter, because when you are forced to wear a mask all the time, you can recognize when someone else is wearing a mask. I think that's why it's very good for us to suss out authenticity, because it's just like, now as someone who literally has to do this to survive, I too can tell that you don't know what you're talking about, and I don't think you're being genuine. So it's going to be a no. It's one of the reasons why I'm like, I did this post about like, I don't like when certain people call me girl. Like, it's infantilizing. And sometimes I feel like you feel like you have to, like when they made it rhyme in that example,
right?
Why can't you just engage with me as a human, on that aspect of humanity, instead of being like, well, we got to make it rhyme, because that's what they like. They like the rhyming.
They like the rhyme, and it's a forced familiarity, right? When we call each other girl, there's either a knowing of the other in the immediate, or ancestrally, like we probably cousins, right?
We're family. There's a collective identity with us. We get it.
And so to not be of the community and to spontaneously say that at the first meeting, then it is an assumption of connection that does not yet exist.
Somebody said something. It was a woman, but this is also like being on social media. Some people they just reside outside their minds, and sometimes they catch me on a good day. And they said something, sis, and I'm like, you don't insult my parents. I do not know you. Okay. That's not how I was reared. Okay. You're not going to insult my mom, because my mom raised me right. Okay. And she raised me and my parents raised their sibling, all of us right. And to say sis, I feel like you insulted my mom right now. But
and you know what? I think along the lines of this dynamic, it also raises that, the diversity within the community. So it's like one person can't give you a pass for everybody else, but some people may be cool with it. So I will say, like on social media and comments, many people have started calling me auntie. I'm good with that. I think about our Aunt Maxine. That's fine, right? If I was in a mall Like, so it's out of this context, I feel like this whatever IG relationship that we are all dwelling in. But if someone just walked up to me on the street and said it, then it would be like, what about me made you think or associate me with your aunt, right? Your caretaker,
Yeah.
right?
Your caretaker, because that's the big thing, right? Like the aspect of, I automatically go to the mammy stereotype because I'm like,
yes,
because I'm supposed to care for you, correct?
right. Yeah.
It's gonna be
Yeah.
a no. Okay. Well, it is. Listen, let me say something.
I love it.
It's not for me. You know, like I'm sure one day I'm gonna get more. But every single time on social media, I'll be like, listen, being a psychologist is what I do. It's not who I am. Okay. Everyone can catch these hands if you act like you don't have any sense. All right. Now, people are like, what about your patients? You're not my patients.
Right.
You didn't receive an invoice, did you? You're not my patient. Okay.
Yeah.
My caseload is full. Okay.
Come on. And honoring, that's one of the things I appreciate, is leaning into the humanity. I think both psychologists and as Black women, there can be a tendency to dehumanize. And so, like, you insist that they encounter your humanity, right? That's what you do, and the way you show up is like, no, you're gonna be reminded regularly, this is a human being you're interacting with, which I think is necessary and unfortunately radical.
I know, radical. I love being called radical. I'm not gonna lie to you,
it's
because
good.
I'm just like, well, you
Means
know,
free.
in order to be an agent of change, you cannot stick with the status quo.
That's right.
It's one of my favorite things.
Yeah.
Well, okay. I have one more question, because we have a lot of clinicians who are out there. What would it look like to, if they're in their training, or even if they've graduated and they're like, this is something that really resonates with me. What would it look like to try to work towards integrating more liberation in their training if they're in school, or in their continued education if they're out of it? Like, what would it look like to go this route?
Yes. So fortunately, the American Psychological Association published a book on liberation psychology. And so I would encourage you to get the book. The beautiful part about the way it's set up is it gives kind of the general overview, but then it talks about applying liberation psychology to particular populations. So that's an excellent resource. On YouTube, there are a couple of like webinars I've been in and other people have done. If you just search liberation psychology, and, you know, be too late for you to get your little CE, but you can still get the information. And then I would just say, as a practice, one of the interventions is testimonials, which is, you know, starting with mindfulness practice, getting people into the body, but then inviting them to talk about experiences of discrimination and how it felt to them, what the thoughts were that came up, how they managed it, how they navigated it, to do that heart listening. And the interesting thing about the way testimonials is presented when we talk about disclosure of the professional is you can also share an experience you've had with racism and how it affected you and how you deal with it. So that's just one of the ways of inviting it in from that narrative therapy perspective.
And I love that, because one of the things that I really gravitated towards was honoring. It's in research, I've always liked qualitative better, because I always tell my students, you can turn words into numbers, but you can never turn numbers into words. If you did a survey and 70% of people in that survey, you found out they were depressed, what would be your next question? Why? I feel like when it comes to the kind of research that I'm interested in, and especially the population of interest, I like being able to honor the narratives, like honor the voices that were so often silenced. Like, I want to hear you talk. I don't want to do the survey. I want you to tell me there is no right or wrong answer. And I think also in therapy, a lot of times there can be different perspectives where it's just like, you're not supposed to share any aspect of yourself or your experience. And I never really gravitated with that in the first place. So I really appreciate that aspect of it. Well, that's the Dr. Thema Bryant. Tell everybody where they can find you. You have your podcast.
Yes. So my podcast,
as well as your book,
Homecoming. The book that's already out is called Homecoming, and the workbook for Homecoming is coming out this June. I invite you to pre-order it. The name of it is Reclaim Yourself, and it's available wherever books are sold.
Perfect. And social media, the interwebs.
Yes, you can follow me as Dr. Thema, and it's spelled as it appears on the screen, DRTHEMA, on X and Instagram and Threads and TikTok, LinkedIn, but I'm not regularly on LinkedIn. But yes, I encourage you to follow me. My website is drthema.com.
Thank you so much, Dr. Thema.
Oh,
We very much appreciate it. I'm not on LinkedIn as much either. It's not as fun to me. I need like
yeah.
yes, show me which stages you're on, but I need a laugh too. Like
Yes. For
I
life, where
can't
are you?
like, yeah,
Mhm.
I need some. I'm just like, there are no
Yes.
videos on this
Yes.
platform. I'm just looking at words.
Yes,
If I
looking.
wanted to read a book, I would go to class. I
I
want to
would
look at
do
some
that.
videos.
Yeah. Well, I so
I need some
appreciate
teaching.
you, appreciate your work. You are such a gift. And so for the sacrifice of time, energy, effort that you spend to educate us and to inspire us on behalf of the community, your national global community, I want to say thank you. Yeah.
Thank you. Oh my goodness.
Mhm.
That's gonna be my ringtone. Thank you.
I love it.
But thank you so much. And everyone, as always, remember to be kind to yourself. 2 steps forward and 1 step back is still 1 step forward. That is just math, y'all. Have a good day, night, week, whatever you're doing. And thank you so much for listening to the show.